Good afternoon, everyone. Welcome to today's live. We have the pleasure of going live today with TFP Fertility, Stacey Rohling, who is the Senior Fertility Nurse at TFP Fertility, the UK's leading network of fertility clinics. She is here now. Welcome, everyone. Requirements. So how are egg donors screened? What is important? How does this help you as an intended parent? So she's very knowledgeable and I'm looking forward to this. Hello, welcome Stacey.
Hi Eloise, how are you?
I'm very well, thanks. How are
Yeah,
you?
I'm very good, thank you. Thanks for having me. Really excited.
Absolutely. It's always a pleasure chatting with you. I know we recently filmed together at the clinic, which is great. And you have wonderful expertise, which I'm so pleased that you're sharing with our community today. So the topic we're going to be discussing is egg donation requirements within the UK. And I think this is particularly important for people who are potentially looking into egg donation and wondering how egg donors are screened, what's important, what the process is. So if you could start by introducing yourself and your role at TFP Fertility, then we can get talking.
Okay, lovely. So I'm Stacey Rohling. I am a senior fertility nurse, but also the donation nurse lead at TFP Oxford Fertility. I've been in fertility for about 20 years and just have a real passion for, helping create families. I've sort of moved on to the donor services probably about 3 or 4 years ago. And again, it's for those couples who have sort of reached the end of their own journey. So to be able to be a part of it and work with all these lovely egg donors who are altruistically wanting to donate and help others, it's a real privilege, and I really enjoy my job.
That's great to hear. As a parent to donor conceived children, it's always a conversation that's close to my heart that I love to talk about because it helps people understand what options are available for them when seeking routes to parenthood. So first of all, I'd love to ask you, diving straight in, the first requirement for prospective egg donors is to fit into a certain age bracket. What are the specifics here about around age, and why is it so important for egg donation?
Yeah, so age is really important when donating eggs because it directly impacts the egg quality, quantity, and overall success rates in fertility treatment. So we know with decreasing age, obviously the quantity and quality of eggs decline. So there's a higher chance of not achieving a successful pregnancy. We also know as women get older, the risk of chromosomal abnormalities in eggs increases also. So this can lead to conditions like Down syndrome or failed implantation failure. So it's about getting, the right donors coming forward to donate at the right age.
Mm-hmm.
Also, younger women do have a higher ovarian reserve and they do respond really well to fertility medications. So, during that donor process, to put a donor through it, we want to make sure that, it could be a good, successful donation, and, older women may not respond as well. But also, you think about the legal and ethical sort of sides of things as well. Just because we can doesn't mean that we should,
Mm-hmm.
or some cases. So it's about making sure that the donor is safe, is well informed, and everything's ethical, and obviously to hopefully create as many successful donations as possible.
Wow. Someone just said I've donated 7 times now, my last one being last month. How
Amazing. It's
amazing.
amazing. Truly special
Yeah.
person. These, really are.
Because you must see a lot of people who are coming to you where they've tried with their own eggs and this is something potentially daunting that they're looking into, and a new route to parenthood. So obviously with it comes questions and emotions and all kinds of things to navigate. So having these conversations is great to empower people with options and with more knowledge about what egg donation involves and the screening process that you have at TFP Fertility. So the second requirement I wanted to touch on is to do with BMI.
Okay.
I know that's a sensitive topic, but what should we know here, and why do you ask prospective donors for this?
Yeah. So yeah, BMI is always a tricky one, especially when you ask, our patients to jump on the scales and want to things. It's important when donating eggs because it affects both the donor's health and the success of obviously having the egg retrieval. Donors obviously take a course of stimulation injections, and having a higher or a lower BMI can affect how the body metabolizes those medications. So it would then affect stimulation, and there's possibly then having lots of maybe less eggs of mature eggs being collected. There's also a theory as well that can be linked to someone having a high BMI, that it could impact egg quality and obviously making successful and then pregnancy in the future less possible. But having a low BMI can also indicate nutritional deficiencies.
Okay.
So that could also then affect egg health. So it's about getting that healthy balance. All right. So increased risks of complications. I mean, an egg retrieval is, it's a sort of minimally invasive procedure, but however, anaesthetics are used. So somebody who has a higher BMI can make administering those medications tricky, but also then it's, it can have an effect on somebody's body as well. So, we do want to be safe, once having that egg retrieval. Someone again who's had a higher BMI might have an excessive response to fertility medication. So therefore, OHSS, that ovarian hyperstimulation, which is something obviously we want to reduce in all our patients, but somebody with a higher BMI potentially then is at higher risk of that. But also due to the nature of the procedure of egg collection, bleeding and infection risks are something that can happen. But somebody with a higher BMI might be more technically difficult to then carry out safely. So, we have a duty of care to, ensure our donors are safe throughout the whole of their cycle.
That's great to hear. If anyone has any questions for Stacey as we are talking, whether as an intended parent using or looking into egg donation or contemplating donating eggs, please do feel free to send us a private message or comment on here. Additionally, we've linked up in our bio the TFP Fertility website to find out more, where all the resources and expertise is there for the team to help you with your personalized plan. So I also wanted to ask about smoking. We know that smoking is not good. Why is being smoke-free so important? And does this include vaping?
Yes, yeah. So again, a very big topic, and yet something that we would automatically decline a donor from coming forward if they were smoking or vaping at that time. It's not allowed when donating eggs because we know it can negatively impact on both the donor's health and the quality of the eggs. So it's just something that we shouldn't be doing. Yeah. We know that toxins, obviously in cigarettes and vaping products, things like nicotine, tar, they damage eggs at a cellular level. So this is then obviously going to lead to reduced egg quality and potentially the increased risk of chromosomal abnormalities. So I think they must have done research in the past that smokers and vapors have had fewer viable eggs, obviously, and then it just reduces the success rates of donation.
Yeah.
Smoking is also linked to diminished ovarian reserve. So even for our own patients, if they were smoking, we would be advising them to stop, because obviously, hopefully on the help that they could increase their sort of egg quality. And obviously nicotine has been known to interfere with fertility medications. So, people might need to then take more medications to actually for the follicles to grow. So, and also it's just going to make the egg retrieval, harder as well, because, smokers have poorer circulation, recovery is harder, anaesthetic risk. So smoking, obviously, and vaping can affect lung function. And again, this can increase complications. And then also, if a donor was smoking and we accepted them, then you think about the long-term health concerns for, maybe a recipient or babies born from their donation. So we do know that smokers and vapors do have a chance of, higher chance of implantation failure, miscarriage, or even sometimes birth defects. So, at TFP Oxford, or TFP Fertility Oxford, we want our donors to be smoke or vape free for at least 3 months, ideally 6, but at least 3 months, to ensure that everything is out of the system before they then donate.
Fantastic. Someone has just said, Becky has just said, I've donated 4 times and hopefully going to donate again. I've always found the procedure and recovery to go well. Again, amazing.
Amazing.
So the fourth requirement I wanted to touch on is to be free from serious illnesses or infections. Can you give us an idea of what this means in terms of illnesses or infections, and why is this so important when donating eggs?
Yeah, so being free from a serious illness or infection, is crucial when donating eggs because it ensures both the donor's health and the safety of the recipient and any potential
Hmm.
baby. So it's really key. So some illnesses can be transmitted through the egg or affect embryo development, leading to birth defects, pregnancy complications, or miscarriage. So, we do have a duty of care to ensure that when a donor is donating, that the recipient is, that there is nothing there that then could be passed on and cause any problem. Things like sometimes viral infections like COVID or CMV, or even rubella may affect egg quality. But things also like chlamydia, gonorrhea, and especially things like HIV and hepatitis, can be passed on, through the embryos. So we want to ensure that when donors donate, that they are, feeling well in themselves, have not had any serious infections or, STIs in the past. Some chronic illnesses, such as sorry, it's gone off my head now. So like diabetes, autoimmune conditions, they can affect egg health, hormone balance, and again, that fertility medication response. So, we do want our donors to be safe during the donation process, but also not passing anything on to the recipient or potential child born of that donation.
Yeah. So this is a really important fact for people to note in terms of intended parents, in terms of where these eggs have come from, and everything we've been discussing today is obviously a huge factor to the potential success.
Yeah,
And as you said, the healthy child that you're looking to have. So it's great to know that all of this is screened so vigorously from the beginning to
yeah,
set people up for the best chance possible.
absolutely. And again, and it's about the egg
Of
donors as well. It's about
course.
ensuring that they're well, that actually starting the course of fertility medications, that they're not going to become more unwell if they're unwell at the beginning. So again, it's about our duty of care to make sure that, hopefully the cycle themselves, the egg retrieval goes seamlessly, they have a speedy recovery, and potentially then may want to donate again in the future.
Absolutely. Yeah, it's incredible. And then in terms of a requirement being willingness to share a full medical history and that of immediate relatives, what kind of things would you be looking for there with the egg donor?
Yeah, so it's really important to share a full medical history and that of your family. So it's essential because donating eggs, obviously, to a recipient, we have a duty of care to them also. So we want to make sure that there are no genetic conditions. So because many genetic conditions can be passed down through the eggs. So obviously we like to assess the donor as well as obviously her parents, mother, father, even grandparents, brothers and sisters, to see if there's anything there that potentially then could be passed down, such as conditions like cystic fibrosis, thalassemia, sickle cell anemia, Tay-Sachs. So, we have a very, very broad questionnaire that they obviously go through, but also then at the medical consultation, it's about deep diving into sort of family history, just so we make sure that nothing can be passed down. If a donor's got a strong history of genetic conditions, then obviously, unfortunately, they wouldn't be able to donate. We also need to ensure healthy pregnancy and baby for a recipient. So, like I say, the intended parents, they've been on a long journey potentially themselves to then use donor eggs, ethically to use a donor that could potentially pass something down is something we wouldn't do. We do follow a code of practice,
Yeah,
to the T,
yeah,
to make this doesn't happen.
yeah. That's great to hear.
Yeah, and again, it's about protecting the donor's health as well, because obviously, hormones and a mindful surgical procedure. So, we need to know, obviously, her medical history as well to ensure that we're not putting her at harm. So, if there was something there that potentially would cause a problem during anaesthetics, or somebody had a blood clotting disorder, these are the things that we have a duty to ensure that the donor does not come to any harm whilst going through treatment and having egg retrieval.
Yeah.
Yeah, a big important part of the cycle.
And I presume for the egg donors involved, this is a way to find out more about their own reproductive health as well.
Absolutely. Right from the beginning of having, an AMH blood test to having a fertility scan to assess everything inside, that's a good indicator for a donor, especially maybe a donor who hasn't had their own children.
Mm.
So again, it's a nice fertility assessment for them to know where they are on their own journey. Potentially, they might not want children in the future, or they may. So it's a good way of actually then letting them know. But then also through the screening, we do genetic screening, we do bacterial screening, and lots of sexual health testing. Again, it's good for them because some people don't know their blood group. They will obviously if they come through for donation, but also we check their karyotype, we check for cystic fibrosis, and some ethnic backgrounds obviously will be checking things like sickle cell and thalassemia. So again, it's a really good assessment of them as a whole, and any donor can have access to their blood test results, anytime.
Yeah. This is why I think these conversations are so important. And it's great that you're here today educating people on this, because we've got egg donors on the conversation. We've also got potential intended parents on the conversation. So to be able to kind of join the dots so people know what to expect and know a bit more about what's involved.
That's great.
I also wanted to ask you about another requirement, which you just touched on in terms of the fertility assessment, but genetic screening. What does this entail for the donor?
So genetic testing, yeah. So we, when they come to us to have their initial bloods taken, obviously we run lots of blood tests. Like I said to you, includes HIV, Hep B and C, as well as obviously things like chlamydia, gonorrhea, but also, the cystic fibrosis and the karyotype. So the karyotype is one that does take a long time to come back, up to 42 days. I've got it ingrained in my brain.
I'm sure.
And this is then, going to show us, obviously, if that donor carries the normal pairs of chromosomes. And that's really, really important to know that somebody has a normal set of chromosomes moving forward into donation, because then we know nothing is going to be passed down. So obviously 46XX is a female, 46XY is a male. And if there was anything that came back and, there was something that was not right, or there was any abnormalities, obviously we have a duty of care again to sort of speak to the donor, and then we would be helping provide some genetic counselling to if there is an impact on the donor and the potential future fertility, then obviously we would support them on their journey, in finding out any information that they can.
And to be able to have that expertise to, find out more is obviously key, so that people can be informed with whatever it is that you might be coming back with, whether it's something that they were expecting or not expecting.
Exactly, and I pride myself in that, if a donor at any stage on the journey of right at the beginning of, inquiring, sort of passing that first inquiring section, to then filling in the questionnaires about their history, sort of every step is sort of making sure that they're meeting the criteria. But we obviously support if they don't meet the criteria. We would absolutely offer counselling if there was anything that they would like to discuss or talk to myself about, and it's just because they might not meet a criteria of potentially the AMH, it doesn't automatically mean that there's an impact on their own future fertility. But obviously we at TFP Oxford and TFP Fertility, we would absolutely go through anything to sort of help them on their journey, and thank them for even inquiring, because that's really important.
Yeah, absolutely. It's worth, isn't it, finding out more just to see whether it's the right thing for you personally, and if it's the right fit. Question that's come in: are donor egg cycles open ID? How much do people know about their donors?
Yeah, so obviously in the UK, egg donation is anonymous up until the point that a donor conceived child obviously turns 18. So all information, identifying information, is obviously kept out, and the information that obviously I'm allowed to share with the recipient couples is obviously things like, they're just characteristics, so non-identifying information such as height, weight, hair colour, eye colour, you know, complexion, but also on the donor information form, which is the form that the HFEA ask the donors to complete. You know, they can actually add things like occupation, hobbies and interests, their religion, but also their reason for donating. Now, the reason for donating is absolutely vital, because sometimes, you know, an intended parent recipient couple looking at this, you know, can be the absolute game change for them, and actually having that little connection with the donor, just have the feelings of why they're actually choosing to donate, you know, can be, you know, a make or break. So really important form.
Absolutely.
Also, there's a section on those forms as well about a goodwill message, but also telling a potential child who wants to read that at 18 years old a little bit, because that form can be shared with them once they reach 18, and obviously then they request that from the HFEA.
Yeah.
So it's a really, and I've actually, there's sometimes I've read these forms and it almost brings me to tears, how the generosity of an egg donor, and you know, their thoughts and feelings about why, you know, they potentially want to do this, and most are open to, if you would like to contact me in the future, I'd love to hear from you. So that's great too.
What kind of reasons have you seen?
I think lots of donors have seen like friends, family members that have actually gone through fertility struggles themselves. That is a real move, and they want to then think, well, actually, if I've had my children, or I don't want children yet, then I want to, you know, help somebody else create a family. And if people have had their own children, they also then say, well, I'm now done. I eggs every month and they're going to waste. Let's share them with other people so they can have what I have, and that is my family. So again, I've got goosebumps already.
I know. I heard this from someone in our community the other day who I was speaking to, saying exactly that.
Yeah.
If my eggs are going to waste, I'd like to use them to help, you know, someone who is finding it a struggle to create their family, or
Yeah.
you know, for a same-sex couple or whoever it might be. It's just a really interesting and special way to give something really special back.
I had a donor who I've worked with for quite a few years, who actually donated 10 times.
Wow.
Oh no, sorry, 5 times.
Okay.
Not times. But, you know, it's an absolutely, was a fantastic donor. The buzz that she got from doing it and knowing how the outcome could be, and I think currently at the moment, you know, with a few siblings in there, she's helped create 10 families.
Wow.
And there are 12 live births at this moment, with lots of embryos in storage. So that is just the best story. She absolutely adored what she did, and what may happen in the future if they contact her, she's there with open arms to say, I did this to help your parents.
It's amazing. That's giving me goosebumps. And I think also, I'd love to know, how much do the egg donors know about babies conceived by their eggs?
Yeah, so obviously we don't contact the donors to let them know if a live birth has happened. So what I say to them is, you know, check in maybe once a year, just to, if you want to know. And what I'm able to tell them is if a child has been born, here it was born, and also if it was a boy or a girl. So yeah, it's very limited information, and obviously that's to protect everybody. You know,
Of course.
So,
Yeah, this is so helpful, Stacey. Really interesting. And also, I wanted to ask you, sort of finally, are there any special cases where you might accept a donor who doesn't fulfill all of the criteria and requirements that we've mentioned above?
yeah.
And if so, why?
Yeah. So
And when?
for altruistic donation, you know, we do have to fulfill that criteria. So unfortunately, if there was any part of that eligibility criteria that wasn't met, then unfortunately wouldn't be able to donate. The only time that we potentially would accept a donation, it would be in known donation cases. So when you have, you know, a couple that maybe a friend wants to donate, or a family member, if they sort of fit outside of that remit. And I would say this is probably more for age, not BMI, because I think we're quite strict on BMI for sex, but age and obviously then AMH testing and fertility scan. So it's about then, if we have the information and the say the AMH is a little bit on the lower side, providing that the intended parents are aware of everything, they're aware of what potential success rates could be, we're ensuring the donor's safety, and the donor and the intended parents themselves, as a known donation, have had the appropriate counselling and are informed, then obviously that can move forward. So that'd be the only time that we would accept anybody out of that remit.
Makes complete
Yeah.
sense. Well, this has been really, really interesting. Thank you so much for your time. Is
Oh,
there anything that you think people should be aware of, whether they're looking to use donor eggs or contemplating looking into becoming an egg donor?
well, by all means, we obviously on our website, obviously there is a section on there about egg donation. So for any of those people that potentially might want to inquire about donation, please just drop an email through. You know, we'll contact you, talk you through the process. You are just by inquiring does not mean you're signing up.
No.
So please don't be scared, just to sort of have that conversation. Again, I work at TFP Oxford Fertility. So if anybody wanted to have a call with me, please phone our clinic, and I'm here Monday to Friday. And again, for those recipient couples who are not knowing what they want to do on their journey, you know, please reach out to one of our local clinics. You know, TFP has got clinics all over the UK, you know, all the way up from Glasgow, all the way down to Southampton. So, you know, we'll be able to give you some advice, tell you about potential waiting times or how the process works. So do please get in touch with us, you know, and we'll help.
Absolutely. Thank you for that. Echoing that, we've also linked up the website in our bio. So definitely speak to the team and work out what's right for you. And as you said, there's no harm in just starting that conversation.
Yeah.
So yeah, agree. Really appreciate your thoughts today. Thank you everyone for joining and those who are watching back. And yeah, it's always lovely to speak to you,
Oh,
Stacey.
thank you, Eloise. Honestly, it's been lovely. And thank you again for so much for having me.
Absolutely. Thanks everyone. Have a good evening.
Bye bye.
Bye-bye. Bye.